are in listen-only mode.
Good afternoon, everybody, and welcome to today's webcast, The Tree of Life Memorial Event Meaningful for Families. We'll start with a couple of audience participation slides. You do have a couple of options to participate this afternoon. One is to submit questions by text to our presenter that will be moderated during a Q&A portion of this webcast. Simply find your question pane, enter the question, and simply hit the send button. Also ensure that your audio tab is set correctly. You will have a chance to also ask your question potentially by telephone, but to do so you need to make sure that you have the correct audio setting. If you're using a computer, please check mic and speakers, and for telephone, highlight the telephone tab. And to ask your question by hand, click the raise your hand button. At the Q&A portion, we may call upon you to ask your question verbally to our presenter today. At this time, I would like to transfer control over to our moderator, Stephen Davidow.
Thank you, Mr. Wyatt. I am Stephen Davidow, Manager of Quality Implementation Programs at the Society of Critical Care Medicine. I serve as the Program Manager for Project Dispatch. It's my pleasure today to host this call or moderate it. I need to make note that this Project Dispatch and this webcast are made possible through a generous grant from the Agency for Healthcare Research and Quality. The content is solely the responsibility of the presenter and does not necessarily represent the official views of the Agency for Healthcare Research and Quality. Next slide. Before I introduce our presenter today, I do want to note that our next webcast will be held on October 15th at 1:30 p.m. Eastern, 12:30 p.m. Central, and 10:30 a.m. Pacific time. It will be the patient-centered approach to community transition after catastrophic injury. It will be presented by Michael Jones and Julie Gassaway from Shepherd Center in Atlanta, Georgia. Next slide, please. It's now my pleasure to introduce our speaker for today. It's Charles Reed. He's the Executive Director for the Center for Excellence in Patient Care at the University Health System in San Antonio, Texas. With that, I'll turn it over to Charles. Thank you.
Well, thank you very much. It's a great privilege to be speaking with everyone today about our Tree of Life Memorial. University Hospital, located in San Antonio, Texas, is the only civilian Level 1 trauma center serving 22 counties. With our recent expansion, we have 716 inpatient beds, 84 emergency department beds, and 35 operating rooms. Next slide. We're also a major transplant center. We do both adult and pediatric liver transplants, adult pediatric kidney transplants, adult pancreas transplants, and we have a very aggressive transplant lung program. Next slide. For our organ donors, we actually average about 16 to 23 for the last 4 years. About 50% of those patients actually came from the surgical trauma intensive care unit. And of those patients yielded 74 to 107 transplants. And we average about 3.9 to 4.3 organs per donor. Next slide. So why should we be doing hospital-based organ donation memorials? Because it truly helps the family in their grieving process. These memorials bring about awareness to organ donation and helps validate that the family made the right decisions through that public acknowledgement and display of the memorials. Now, typically, though, organ donation memorials are put on by the organ procurement organizations, and so very prior to about 2005, there were actually very few Tree of Life or memorial walls throughout the United States. Next slide. So what are the prevalence of hospital-based organ donation memorials? Well, a survey of 9 organ procurement organizations, they responded to a survey and reported covering 941 hospitals, of which 374 were considered donor hospitals. That included 43 that were transplant centers. Of those hospitals, only 39 of them had active memorials, 19 were in the planning stages. And when we asked about who organizes and who are funding those memorials, 75% reported that the memorial was a shared collaboration between the hospital and the OPO. And they also reported that they were pretty much equally funded either by the OPO, by the hospital, and then the rest had reported that they were actually being funded through grants. So what was our catalyst for the Tree of Life? Well, it came in 2005. So in August, we had 2 young men come in with non-survivable injuries airlifted to our hospital. And it was amazing that in the midst of these families' loss and grief, that they were asked to make the decision to donate their loved one's organs. And I was the unfortunate one to call a mother and explain to her that her son had been severely injured. We were trying to make arrangements for her to get to the hospital. And literally within 2 hours, she had been approached by the neurosurgeon that basically her son was brain dead or would be soon. And they were approached about organ donation, and she was able to make that decision. And we were just amazed at, I was just amazed that this mom could make this decision at the worst possible time. And I was thinking, how would I respond to that? In the room next to this patient, not only was this person ended up becoming brain dead, the person next to them actually was not brain dead, but actually became a donation after cardiac death case. And once again, I remember meeting with that individual's parents and the donor's son, and once again, they made the same decision. And it just takes such great strength. And so in our transplant clinic was located in our hospital, and it was adjacent to our trauma ICU waiting room. And so along the walls of the waiting room were the pictures of those transplant recipients. You know, these people are extremely happy to be getting these gifts. And it was on Saturday that we realized that we don't do enough for the families. I mean, we celebrate and we recognize those that actually receive the organs, but we weren't doing anything for those that actually were the ones who were truly giving the gift of life. So basically on that Saturday, we called the Vice President of Corporate Communications, the Director of the Nursing Unit, and really realized that we truly needed to do something to honor these families' legacies. And so working with the Texas Organ Sharing Alliance, which is our OPO that serves South Texas, we worked with the hospital development person and really realized that we truly needed to do something to honor these families. And so we brainstormed and actually had decided to come up with a Tree of Life that Corporate Communications then had worked with graphic designers to develop. I know other people who are doing this type of services will incorporate chaplain services, and if they have organ donation PI committees, they bring those people in, and other family services either through the OPO and stuff. And so this was truly an initiative that was brought from the staff to the senior leadership of our organization and to bring it forward. So the logistics of hospital-based organ donation memorials. You know, in designing and planning the donor memorial, there are definitely lots of things to consider. And some of it really goes outside of even the budget. I mean, there are really some low-cost things that people have done. I'll show you examples of our Trees of Life. And the first one actually was, as I said, designed by a graphic artist. They actually printed it up, and we actually put it up like wallpaper on a wall. The following design was actually painted on by an artist, and then now we have our newest one, which is actually outside, and we commissioned it. And so, you know, looking at your own organization, you have to think about where do you want it, how are you going to protect it, how are the family members going to interact with it? Because these donor memorials, the families want to touch it, they want to interact with it, they want to have access to it because they want to come back and see it outside of your yearly memorial event. I mean, we have families will come in and leave flowers by the wall of the transplant unit where this memorial is located. So you really want to be thinking about how will people access it, when can they access it, what is the impact for people who walk by it, who else gets to see these things. And so I think location is really critical. So for our first location, we actually had it on the transplant unit. So when you walk in off the main elevators, the first thing you saw was this Tree of Life with a plaque next to it, and you saw all the donor leaves on it. It was an extremely powerful statement. So all those people that receive the transplants truly understand truly can appreciate how many people have lost their lives and what that has done for them. And having these public memorials, it brings awareness to organ donation. We had an incident where a family member was up at the Tree of Life, and one of the social workers found this person, and this man was upset and crying, and he asked about who were these people on the wall, and they explained that this was our Tree of Life. And it turns out this was the dad of a pediatric patient, and someone had told him about the Tree of Life, and his daughter had been in a car accident, and they were going to pronounce her brain dead. And he came up and was looking at the wall and asked about these people being heroes. And it was seeing that memorial then that helped push him that he wanted his daughter's name on the wall, and he wanted his daughter to be a hero as well. And so it really does bring awareness to organ donation. And it's when you have these memorials and you see these people who've given the gift, it's extremely powerful. Now you also have to decide on, is your memorial going to serve just the solid organ donors? Is it going to serve the people who've donated tissue and corneas? And what happens if they recover organs and the organs are used for research and not actually transplanted? So for our organ donation memorial, we honor currently those that donated solid organs. If we did tissue and cornea, we would have needed definitely a much larger wall. And so moving forward, our plan is actually do a separate ceremony for those that do tissue and cornea. But at first, we never even thought about doing tissue and cornea until someone in the organization had lost a family member, and they'd asked about it, and it sort of hit us like they're going through the same loss, and their family member they may not gave the gift of life, they gave the gift of improving someone else's life, and shouldn't they also be honored? So those are things to think about as far as your size and your scope of your memorial. So this is our first Tree of Life with an example of the letter that went out to the participants. We actually sent the letter out. We were going to go back 10 years, and we actually went back. The OPO is one who contains the database of the organ donors and the families and the addresses and stuff. So you have to work really closely with your OPO. So what we would do is we would actually draft up the letter. We put it in an envelope. We give it to our OPO. They then put it in an envelope and address it. So we do, the privacy of the patient and the family is honored because that all still resides with your organ procurement organization. So this is the Tree of Life that the graphic designers had come up with. The nice thing about this tree is that there is dedicated spots for these brass leaves to go. And as our Tree of Life has progressed, it changed. So you may want to, once again, these are things that you will want to consider when you design your own. Are you going to have spots for these tags or these plaques or these leaves to go, or can it be randomly placed on these? So this is actually the Tree of Life on the wall. The mural measured 20 feet by 10 feet high. Was placed in the transplant hallway, and it was in 3 panels. And then the balloons off to the side of it. So during the memorial event, we actually have white balloons that represent the families or the donors, and we have the green balloons then that represent those that have received the organs. So planning the event and getting the schedules out. We do send out save the dates for the families, and so not only will they get a letter, then they also will get a follow-up reminder card of the upcoming event. And on the screen then is an example of the letters that we've sent out. And now we've changed our design with our tree, and so now you're going to see our parts of our newest tree, which then was actually hand-painted on the wall by an artist. Once again, the OPO is the one who handles all the addressing of the letters, and so that maintains the confidentiality of it. And we typically notify the families about 60 days out from the start of the event. We do save the dates for the hospital staff as well, especially for our senior leadership, notification of our board of managers. We don't allow the media at the event. We've only allowed them at the event once, and it was just to do a written story because we really felt that this was for the families, and we didn't want it to be a media event, but we wanted to feel for people to know about it. And so, as I said, we don't allow photographs or photographers there for media purposes. Now for speakers, we actually invite our trauma surgeons, our transplant surgeon. We have donor families that will talk. And so getting on the calendar for our medical director for trauma services and medical director for transplant services, we will actually start planning that 90 plus days out just to make sure we can get on their calendar and make sure that they will be in town for the event. And now the organ procurement organization then works for getting the donor family. We always simply have one family that will speak. And recently another hospital here in Texas, they actually have a recipient come and speak, which I think is a really nice idea. And having that, we just have the perspective of the donors' families, but having that perspective of a recipient really helped change the mood and really lightened it up. Once again, you have to have the right person, but they said, one of our OPO representatives was there and said it totally changed the mood and was really well worth it, and something that we will be considering for our next event. We also started doing, started doing this last year, was we actually do a certificate of appreciation. And so once again, going through, getting the letters, the invitations, and the certificates printed up in the programs, we do that about 30 days out. We will go ahead and print the certificates with the organ donor's name on it, even if we have not heard back from the family, whether they will be attending or whether they want their family member's name on the leaf. The reason we do that is that some people literally will decide, some people will be in the parking lot and decide whether they can come back into the hospital, because this may be the first time that they've been able to come back onto the facility. And so you just never know, and you don't want these families, it takes such courage, especially for the first time and second time, for them to come back in and come back into the hospital where they lost their loved one. So you don't not want to have these things. And the cost associated with this is so minimal. And so once again, every year we re-invite everybody who has ever attended. And then we redo certificates and leaves then for everyone that has died in the previous year. So typically we do our event in April, and what we would do is from January back from the previous year, we would, from previous calendar year, we will engrave all the leaves with their names, their first initial, their name, and the date that they died, the year. And so once again, it's having those, because families will show up, and when you don't have that leaf for them, you can just see the look in their face. So once again, we just go ahead and do it anyway. And some years they may not come, but then they come the next year, and they can still then put the leaf up. And those that don't come to the ceremony, then we will actually then send them their certificate if they had wanted us to place a leaf on the tree for them. This is an example of our brochure, or the program that we actually do for them. Is this once again just bifolded and talks about who's going to be speaking. So for the leaves, as I said, we do the first initial, last name, and the year that they passed. You want to think about how are you going to secure whether they're leaves or tags or to be your wall, your memorial. We've used adhesive tape in the past, and that's worked. But South Texas has a lot of humidity, and if they come off, or if people can walk by and pull them off, and that has happened, unfortunately. Families have come back in and have not been able to find the leaf on the tree. So now we've gone through is we will have the family place the leaves on the tree with adhesive tape, and then we will go through and have our maintenance department then secure them with brass screws. And then actually over the entire tree of life, we actually have plexiglass that is mounted that protects it. So that thing can hit it, no one can pull leaves off, no cart can hit it and damage it, and that has worked out really well. We also do, as part of our program, is every year we give the donor families a mountain laurel. We order those. We start planning those about 6 weeks out, make sure we get enough of them in. We always over order, just in case. And if families come every year, then we give them mountain laurel every year if that's what they would like. We order balloons, and as I said, when you have 20 organ donors and you see the 20 white balloons, and you see these 80 green balloons, it makes such a statement, and it makes such a statement not only for the donor families, but for all the people who may not truly understand organ donation, your hospital administrators and even the nursing staff. I mean, you know that your unit had 5 donors, but you don't think of those 5 donors as equating into 20 or 22 or more, people's lives being saved. And so I think that's extremely powerful. We do have a registration table that we set up in the hallway on the day of the event. And we don't typically, in the past, we haven't always had someone manning it, and we have started doing that and getting people to sign in. We've put up, you put up signage directing the visitors to the event. And since it was on a different floor, we actually had people then at the elevators greeting them. For some, once again, this may be their first time back in the hospital, and it takes a lot. It's a lot for them, and so having them follow the signs and stuff may not always be easy, or you may not just be aware of it because it is such a emotional thing to do. We also have staff then, so if they're at the registration table, sort of describing what's going to happen, and when we call their family's name and having them come up and put the leaf up there. Also, the families that we've interviewed, I will talk about, they really enjoy seeing the staff, and so we will get a list of the organ donors and what units they came from and who the nurses were, and we will invite those nurses if they can get away. But we also we'll invite the techs, we'll invite the unit clerks, because a lot of times you don't necessarily remember the patients, but you remember those families, and those families then can connect with those nurses and the staff again, and it really helps that comfort, because these families who've never been, they don't know what to expect. And so seeing people that you remember, back in the units that your loved one was in, it's so important, and they are so appreciative of it, and that the staff would actually take time to come and honor them and their loved one. Yes, also when you're thinking about the environment, it may be quiet, but then when you put in 30 or 40 or 50 people, it can get really loud, just sort of the bustling of the people. The people will bring their children, babies may start crying. And so once again, the visitors are crying, and so is the staff from these events. And so having a podium and microphone is definitely a great idea. You want to give some also thoughts to what else in your environment could be a distractor for the families. And so we will work with our communications department to turn down or turn off the PA system in that area of the hallway, because having these announcements right where you're calling out loved ones' names is difficult. We'll secure the doors so that automatic doors aren't opening and closing, automatic faucets aren't going on and off, and so making sure that environmental services then won't plan on waxing the floor and doing these things in the middle of that. You also want to work with plant engineering, because although the environment may be cool, you put in these large number of people, it can get really hot, and so we typically cool down the area earlier in the morning so that it doesn't get too hot. And then you also want to know, so after the event, where are you going to bring these people to? Are you having a reception after the fact? And luckily for us, where we've had it, there's been a conference room, a very large conference room that we always serve food and stuff in and give out the mountain laurels. So those have been extremely helpful. But once again, you sort of want to walk your environment and look at all those things that may make noise will. People back up into automatic doors and open them up, and so you really want to give those some consideration. The agenda. So our nursing director of the surgical trauma ICU is the one who's always done the welcome and goes through and reads her introduction and script. And we've truly scripted everything out for everybody. And so year to year, we already have the scripts written, and they will just go through and tweak it, because once you get up there and the emotions are going, sometimes it can be very distracting. So after our nursing director does the introductions, we have the director of pastoral services do the invocation. And then we actually have then our medical director for the transplant unit talk about the recipient side of receiving a transplant. We have our trauma medical director that actually will talk about the loss that those families have gone through. We then bring up a donor family and talk about what organizations and how being a part of these events has really helped change them and has really helped them heal. And then we invite staff nurses actually to come up and have remarks to make, and they actually will call out the names of the families. They will ask them to come up. They give the leaf to the family, And you can tell the families when they place these leaves, it is so intentional. And so they come up and then we will ask them again if there's something that they would like to say about their loved one. And you really have to encourage it. These families want to say something, and some of them, they just don't know what to say or how to say it. And you really have to encourage them. Is there something you would like us to know about your son or loved one? And sometimes once you get one person going, then other people will start talking about it also. And then we hand them their certificate. We have the CEO from our OPO talk about what organ donation and what their gifts have meant to the community. And then we have our closing remarks by our nursing director, and then we then move everybody into the reception area and do light food or light lunch. We typically have it 1, 2 o'clock in the afternoon. And when we've looked at times and stuff for these memorial events, there's not, and we've interviewed and we've said what time works better. Nothing has really been, Friday seemed to work a little bit better. We had one this last year on a holiday, and we thought the turnout would be really poor. Actually, we had a phenomenal turnout because kids were out of school, and so these donor families brought their entire family because they were off for a city holiday. And so our next event, we're looking at doing something more in the evening to see can we get people in. And people who have not attended, they've said some of them live out of town, they're hours away. They said, trying to get off work and get in there on some of these people who truly work for a living is really difficult for them. And so I'm not sure if there truly is a better time or not. And I don't know, we've never considered it on a weekend, and that may be something that we would look at in the future. The other thing is the family we talked about, when having the staff call out their loved one names truly means the world to these families. Because when someone passes, a lot of times the families have commented that people don't want to mention the name. They don't want to talk about your loss. And one of the families I had interviewed, commented that she goes to this one particular memorial, and she goes there because every year they call out her daughter's name, and she said, it keeps my daughter alive. She says, because after a while, people don't mention your daughter. Having someone call out their name gives them that recognition, keeps the memory alive, and it's that public acknowledgement that they were somebody and that they were this hero. So these are photographs of some of our families placing the leaves on our first tree of life. And they kiss the leaves, they put the leaves on, they take pictures of the leaf, they take pictures next to the leaf, they take pictures in front of the tree. It truly means, they really want to connect with this. I can't stress enough of how much these families, when I've interviewed them, have talked about what coming to these organ donation memorials mean, and really what it means to have the hospitals do this for them, because they realize that the hospitals don't need to do these things. The OPOs do them, and they realize the hospitals don't need to, but it truly means the world to these families. One of the families in front of the tree. We have a plaque next to the tree of life, and it says, and as we move from our initial tree of life to the version that's actually painted on there, it says, the tree of life dedicated to those whose legacies live on through organ donation. We mourn the loss of these precious loved ones and honor their families who made the decisions to give the gifts to others. And we decided we moved away from the notion of this tree of life and really became this branch of the tree of life, because we felt that we aren't the only tree of life, and we aren't the only ones saving lives, and so we really felt that we were part of something that was bigger. One of the moms, though, had made a comment that she was offended by the plaque, and she says, I'm not here to mourn the loss of my daughter. I'm here to celebrate the life. And so I just want to mention that, because you may want to think about when you do these memorial events, these families really want it to be a celebration of gifts of the legacies of their children and their family members. And so we have not changed this, but when we get our new plaque, we will reconsider the wording of it, because and I sort of agree with her. She says, I'm done mourning. I need to celebrate what my child has given to others. So this is our Tree of Life in 2008. The branch of the Tree of Life, and we felt that we actually hired an artist that actually painted it on the wall. So the difference between this tree and the other tree, depending on truly how concrete you are, is that some of the staff liked it. Some of the staff had concerns because you didn't have designated places for people to put the leaves, and so they were putting them everywhere. And people that are, some people really need that structure of why would they put a leaf here? But these people, these people purposely choose the placement of these leaves, and you can't tell somebody, oh no, that doesn't look right. And so my personal opinion would be is that you really have some structure of where you want these leaves to go. Otherwise, families will put it everywhere and anywhere on this wall. And then once again, as I said, we've gone back through and there's plexiglass then that mounts, 3 panels of plexiglass that mount over this to protect the painting and protect all the plaques that are shown. Placing the leaf on these, once again, really gives the family that moment to remember and to honor their loved one. We also, once again, once they put the leaf on, we go back through and we do ask them, once again, is there anything they would like to say about it? And then once they place it, then we give them the certificate. As I said, they will bring their whole family, and they will let their younger children or their younger brother place the leaf on the tree, or their mom, their grandmother will decide where the leaf is placed. And so, again, when you watch these families do this, it's extremely powerful, not only for the hospital staff, but also for the families themselves. This gives you an idea of sort of what that whole wall would look like with the families there. So we've now moved to a Tree of Life Book of Memorials. And so as we planned and designed the expansion of our hospital, we really wanted to incorporate this healing arts program into this, and this was this public art program at University Health System. And one of the aims of the project was to communicate, our important mission through art. And we did this, for our organ donors and recipients as we commissioned this Tree of Life Book of Memories Memorial to honor the legacy of our organ donors and to demonstrate our continued commitment to those families. And so it's a huge sculpture out in the garden. It has 6 panels, and the panels measure 4 feet by 8 feet. And the artist, Susan Wallace, actually was the designer for it. And she said the tree needed to become a vehicle for the families to pay the lasting tribute to their one. And so we had invited her, before she had designed the tree, to actually attend one of the Tree of Life Memorial events at our hospital. And she said it was important that the Tree of Life stand out from its organic surroundings by framing the tree, limbs and leaves, creating the reference to a book of memories, and thus adding layers of meaning, enhancing our personal experience. She said the hanging blossoms of the medallion will float in the breeze, and these inscribed medallions become the ribbons of commemoration, speaking to her hopes and reflections. And she said, this was really one of those, like, similar to Tibetan prayer flags and yellow ribbons and, pages of a scrapbook or a diary of memory. She really wanted it to have true meaning to these families. She said watching how these families interact with the former tree and then talking to the nurses afterward, she said really guided her through in the design process. And once again, that this tree truly needed to be this vehicle for this family. And I think she did an incredible job. And so the tree will hold approximately 500 tags for the families. So that will get us through a few years. Here's more pictures. And so the tree is actually on display and accessible in our public garden. And so it's, it's truly it's truly breathtaking. And so we've gone ahead and put on the tags on sort of controlled where the tags have gone on the tree currently. And then every year we will add additional tags. So we've placed actually extra tags. So right now the families, when we do our next memorial service, all the families who have ever been invited before will be invited to come in and then put tags and sort of christen this new memorial. And so we placed enough tags on there that people have choices of where do they want their tags to go. And once again, it was really important, and the artist saw it, they need to be able to get up. We felt that having it on the raised bed keep people from damaging it and not going up there, but that we could secure the environment enough so that during the day of the event, the families can actually go up and touch it because they want to touch these things. They want to connect, to these medallions and to this tree of life. Here's just another picture from a different view. And it's truly the focal point for our outside patio garden. So measuring the impact. So we, a couple things, and we wondered, we did this, and we wondered, what was the impact of inviting these families? Are you just opening up this wound, and is there a time that we should invite families or should not invite families, or when do you stop inviting them? And so we interviewed these families that have attended our event, and the families said they've received nothing but benefit from attending these events and nothing but benefit from receiving the invitations. They've also commented that one of the dads I spoke to said, please don't stop sending these. I'll make it one day. And he said he actually started crying because he thought it was going to tell him that we would actually stop inviting them because he never did invite, that he's never attended. And this man, works multiple days a week, and he says, I just cannot get away. And so between my job and I still have my other daughter to take care of, it's really hard for me. But he said it is so important for him, and it was so important for him to let us know that please don't stop doing these memorial events because people may not show up. He goes, it means so much to him to be recognized and remembered every year. So during our interviews, some of these themes came out as we transcribed these interviews and really looked at the data. And some of the themes were this, into public domain, keeping their memory alive, helping them to be able to connect, and healing. And and it really truly starts with their decision, with their family's member decision to attend. However, the first two families that I spoke to and I interviewed had never attended the event, but they said it was so important to them. It was so important for them to know why they don't attend, and that please keep doing it, and we will be there 1 year. And one of the families says, I know it's been 6 years, and they said, me and my wife are just not ready yet. And so everybody has their time when they are with them, when they will be ready, but they are so appreciative of these things. So in the public domain, really is the catalyst for these families to heal. It brings about awareness, discussion, and really support organ donation. And the Tree of Life event is a means in which that they can share with others this private loss and decision to help others. And it's the sharing in this public forum that brings about this catalyst for discussions of not only personal feelings and loss, but also the heroic decisions that they or their loved one had made. And all this then brings about, the education, awareness, and importance of organ donation. This one uncle commented, I don't recall a time when organ donation came up. It just, in a general setting, and he said, you don't just start talking about organ donation. And he goes, I had never even thought about it. And so, prior to these events, families may grieve in private, but, families of organ donors, look to organ donation memorial services as a way for them to communicate, to share their loss, their courage, their stories, about making the choice to participate in organ donation. And as families and friends and people in the community attend these events, organ donation really truly moves to this higher level of acculturation. Families become advocates, which lead to heightened awareness for organ donation. We had this one donor mom said, we can spread the word about organ donation with people. Another mom said, partaking in groups and all those things impacts and truly raises awareness. And so I said, so really, doing these events truly brings about awareness, not only to the public because people share these stories, they bring people with them, but it also heightens awareness of your own staff. Even though we all work in healthcare, we have staff that know about your level 1 trauma center, transplant center, you have organ donors. Once again, it shares with them, and it truly brings more awareness of the people who donate and who those people actually were. Being able to connect, not only was this about connecting with oneself, but also the loved one that they lost and others, and also talking in this communication also helped validate the reasons and that they had done the right thing, and also help normalize the act of death. The Organ Donation Memorial provides this opportunity in which to connect back with society. It helps these families connect back to the memory of their loved one and themselves. It brings together groups that share in the same experience and loss that enables people to connect. You know, a donor father had told me, he goes, you can't go through a grocery store and see someone and speak to them and have them understand what you go through every day. He said, people just, unless they've gone through it, they will never understand it. A donor sister said, you know, it's a place where I can be with other people that are in my situation and know how I'm feeling, truly know how I'm feeling. And another donor mom said, I think that, you know, connecting and reconnecting with people and being able to, there was a time that I couldn't even have these conversations. There was no way I could even say her name. And so the Tree of Life Memorial, you know, provides and means maintaining a relationship with their loved one through this physical connection and through this remembrance. Donor mom said, you know, I was seeking gatherings. I was seeking some kind of connection to honor her in a way. And another donor mom said, you know, something that has her name on it, something that's tangible that I can see and I can touch, that helps. You know, connecting helps us facilitate the healing process, and it allows for the development of these new relationships with others that share in the similar experience. Keeps the memory alive. It was really about this public acknowledgement, not having their loved one forgotten, and really wanting their family member to be honored. And you know, families of organ donors need that general public to realize that the gift that their family member has given to another. They really want and desire this visible confirmation of their family member's gift for all to see. And a donor mom said, it's the general acknowledgement to the public or in the public that was important to me, that she existed. And another mom said, I like that there was something permanently put in place to honor her. People that will walk by don't know who my daughter is, but they will know that she was a donor, and that may move someone. And a final donor mom said, I just tend to appreciate the fact that someone's recognizing the importance, you know, of organ donation and being able to recognize the importance of the active care of the family. So once again, they are so appreciative of healthcare organizations doing these and having these public displays, and once again, it reaffirms of what, you know, what they've done is truly the right thing. Lastly, it brings about healing, and this is really helping them transition to develop these new traditions. And once again, it really helps the validation that they did the right thing. Annual donation memorial services provide a new tradition for organ donor families to gather and participate in activities that really include, you know, their missing loved one. The initial reason, though, that families participate in ceremonies is to help them cope with the grief and acceptance of the death. However, over time, the meaning of attending actually changes. And so once again, it moves from this needing to reconnect and help me with my grief to this is now a new tradition for me. And it's something that I want to do. And so it gives them this connection that's going to help them. It's really, you know, and a donor mom said attending the first was for sport, and now it feels like a tradition. Another donor mom said, one of the things that was really important for me and my children was tradition. I can't celebrate a birthday with her, but I can go there, and that would be my way of reestablishing some sort of tradition with regards to her. Another person said, you know, it's nice to be able to connect to something. In her honor, it feels like it's a chance to acknowledge and remember her. And so again, it feels like reestablishing traditions with her, for her. And more importantly, you know, it was all about her. And so, and as these other families have said, it's been absolutely essential to their healing. You know, it's this beautiful acknowledgement of the donation and of the person. And that attending over years allows us to heal, you know, from his death and that it wasn't in vain. And these are so important to these families. And once again, they realize that hospitals don't have to do these things, but they know hospitals do. And so in summary, you know, really our qualitative evaluation from the families has provided the critical proof that we truly have succeeded in supporting families in their grief. These memorials provide a safe environment for being able to share their loss and create a legacy for their loved ones. Families have shared that the Tree of Life event provides a meeting place for those from a club that nobody wants to be a part of. And they comment that it's this release for me to be able to talk to people who actually know what I know. It provides a means of recognition and remembrance of the life given. The invitations are also another means of supporting the family's legacy and the importance of their loved one. And so that one dad said, I want to receive them the rest of my life, It's something that I look forward to receiving. I put them on my refrigerator, and that is the first thing I see in the morning and the last thing I see before I go to bed. It lets me know that we did something good for somebody and that my daughter's sacrifice was not in vain. So these organ donation memorial events truly support the family's decision to donate. And they say, it makes me feel important. It makes me feel important to somebody. Additionally, it provides a means of continued support throughout their grief process. And Mom said, it's a real blessing to know that other people support you and they come and share. It's good to get to hear other people you know and how they deal with the loss. And so these memorial events, it's also an opportunity to increase awareness of organ donation. And one of the family members said, I never thought about organ donation even when my husband passed away. This made me remember that I needed to sign up, and I did. And if y'all have any questions, I'm happy to take them.
Okay, well, thank you, Charles, very much. As we wait for questions to come in, I just thought it might be interesting for you to talk about the time that you've had this event going on, how that reflects or has impacted, or both, the culture of your organization and how it reflects the patient-centered approach of your institution. Obviously, hospitals and trauma centers are always patient-centered, but it might be interesting for you to talk about how this relates in general to your organization.
I mean, it's truly brought about awareness that we need to do more for these families. And one of the things that we've done, which I know other organizations are doing the flags for organ donation, and we've actually taken this one step further. So based on the feedback that we receive from the families and what the organ donation memorial means to them, we actually now have a organ donation woven blanket that we've done up that ties back into our tree of life. And on the border of the blanket actually has the main words that these families have conveyed to us. And so basically now when a family member when someone's been pronounced they're going to be an organ donor, we will present the family with this blanket. And so we bring them into a conference room and we talk about the blanket and the tree of life and what all this means to us. And we talk about how can we create this moment for you. And so we will go into the room and place the blanket on that patient, because we know when these families come to our organizations, not leaving with something is devastating to them. And we do a lot for the pediatric population as far as handprints and locks of hair and stuff, but we don't necessarily do things as much for adult patients, that aren't in a pediatric unit. And so we've just started the blankets in July, and it has truly brought about. The first family wrote back to the hospital and said, when we presented the blanket to Mom, I didn't think she was going to let go of it because it meant so much to them. And in talking to families, they say, I brought my loved one in. I need to leave with something. And we've had parents who've put bloody washcloths in their purse because they needed something. That was the last thing that touched their son, or they want those socks. And so having this blanket as this memorial that touched them during this organ donation process is extremely powerful, and it gives them something to hold on to. And so now we're doing this for all of our organ donors. But it's really it's really heightened the awareness and sensitivity of what we need to do for our organ donors and how we handle people and the families when they're grieving and when they lose somebody. And so we've changed our process on how if families come in after a family wasn't located and someone passed away, we now have viewing rooms that we bring them up in. We bring chaplain services in. People aren't allowed to go down to the morgue, or sometimes we'll actually bring the patient back to the ICU and have the nurse there with them to explain it. And so we've truly done an incredible job of trying to meet these families at the worst time in their life.
Okay. Well, we have a couple of questions that have come in. I'm going to ask, and here's the first question that I'll ask. Did you remove the original tree as each new one was developed? If so, how did the families who had already placed leaves on the original tree react?
We actually sent a letter out, a letter to those families explaining that we were going to do a new dedication. And so it was on that same wall. And there hasn't been discussion. I think there's been no discussion yet what we will do this time, whether we will just leave that tree up and leave it secured. But there's been no one felt we've never had any negative response or someone come back and say, no, I didn't like doing that. We told them if they didn't, then we would be happy to put the leaf up for them. And so we reused the leaves were the same from one tree to another, so we didn't engrave new leaves. And so no, there was never anything negative, but you do worry about it. And I worry about if we got rid of the wall now, what would that mean? I mean, putting them back on the same wall for the same meaning, I think, is one thing, but totally taking down that wall and moving them outside, I think, is different. And so my personal preference is that we would maintain the wall as it is, but put all those same people that are on that wall onto the new tree of life.
Okay. Our next question is, what kind of consent did the hospital require from donor families? A signed consent form?
We actually send them a letter, and so they respond back to. We tell them that what we would like to do is put their initial last name and the year on there, and so they respond. They write back to us, say yes, they do. And as I said, even if they have not written back to us, we will go ahead and grade the leave just in case they show up. But we don't truly have a consent form. We don't have a consent form that they sign. If they showed up and we had leave, we would not have them sign a consent form. And most of those people want their family members honored. That's not a issue for us. And we actually had a person who couldn't wait. And you never know when do you send the invite out. We actually had a patient who died in January, and the mom could not wait for the event. And actually, then we brought the mom in with our OPO family services person. We actually did a memorial just for the mom, for her daughter, because it was so important. She needed her name on that tree literally 2 weeks later. She just had to have it. And so it's all about meeting the family. And they've done so much. And when you're with them, and this mom was actually in the operating room for the organ donation because the patient was a donation after cardiac death. It just meant so much for her to be there. You can't deny that.
All right, we have a follow-up question. A person asks, if they didn't write back yes and you made the leaf anyway, did you place the leaf on the tree anyway?
No, we hold on to them. So we won't. If people have written into us and said yes, please place my family member's name on the tree, then we will place it. If they do not, then we will send them the certificate. If we've engraved the leaf and they never responded back, we hold on to the leaf, and then we will bring it with us every year in case they do show up.
Okay.
And then on our new tree, since the tags are so much larger, we will actually allow them not only to have their name and the year that they passed away, but they will actually be able to have a phrase or some words that actually describe them, because those tags that actually hang swivel. So one side would actually have the name and the year, and the back side would have something about that individual.
Well, thank you, Charles. We don't seem to have any more questions, so if you have any further last comments that you wanted to share, please do. Otherwise, we'll go ahead and bring today's webcast to a close.
I just think that these events truly have, as the families have never said, that they've had anything but benefit from receiving the invitations and attending these invitations. And when you go to these events, if you've never experienced one, it truly means so much to these families, and I think it truly does bring about awareness of organ donation for those that don't know. And again, it really helps support and validates, and it really helps these families heal, because it validates that what they did was right, because they do question that, and they do question, and they need that validation, and they truly need that acknowledgement of what their loved one did. And so I think these events can be done at from various of costs. I think that all organizations can do these things. I think it is so impactful for these families.
All right, well, we are getting a few comments in. I just wanted to let you know that people are thankful for your presentation, and I, on behalf of Project Dispatch and the Society of Critical Care Medicine, thank you for your time today, Charles, as well as for our attendees, or to our attendees for participating. Thank you, and we'll bring it to a close.
Thank you.